Let's hear from Reverend Stacy Auld, who's the director of our spiritual care and education at Houston Methodist Hospital. We're a faith-based organization, and this is an area that I think is very important for cardiovascular health, is spirituality. So, Stacy Auld, please tell us what you think about that.
So the question that I am answering is, does spirituality enhance heart health? And the short answer is yes. I'm going to focus my remarks on some of the research that Dr. Harold Koenig is doing at Duke University. I was personally influenced by him as I studied theology at Duke Divinity School, and he serves as the director for spirituality, theology, and health at Duke University Medical Center. So the bottom line in this research that's being done is that, in the majority of the studies, is that greater participation in religion and spirituality is related to fewer negative emotions, which those negative emotions are typically increasing the risk of cardiovascular disease, and also increasing positive emotions, which will help reduce the risk of cardiovascular disease. And this one paper that was summarized a lot of things for me and did it was a great study that was actually done in Brazil, because Brazil is a highly religious country. But I think a lot of the results I see as a clergy person here in the United States being true here also. So this paper highlights 3 different pathways through which these positive emotions increase, which is what we're looking for to reduce the risk. And the first pathway is the psychological pathway. So studies are showing that participation in religion and spirituality decreases the probability of stressful life events in general, simply because our influences and our behaviors are better. It also gives a greater sense of meaning and purpose to the stressful life events that are going to happen regardless of how good our behaviors are or the things around us. And also, participation in religion and spirituality typically leads us to look to our sacred text and look for role models that are dealing with adversity and learning from them the psychological resources that we need to cope and adapt to things that are happening to us. So in all of those different scenarios, the result is more positive emotions, like more positive well-being, happiness, optimism, meaning, and purpose, and fewer negative emotions like depression, anxiety, low self-esteem, and hopelessness. And we know, and what we've heard from today, that these psychological benefits of our participation in religion and spirituality, if they produce these more positive emotions, we know affects our immune, inflammatory, and endocrine functions, which and then in turn influences our cardiovascular health. The second pathway is what's called a social pathway. So if you think about, these studies are showing that if you are involved in a community of faith that's promoting forgiveness and nurturing pro-social attitudes and activities where we experience people and connections with each other, that we actually have these more positive emotions. Religion and spirituality typically also provides social resources to build better and maintain better family systems, better marriages, friendship networks, that then also help us adapt and cope when things are difficult in our lives and those stressors begin to bubble up. Social support also influences our behaviors and our attitudes and affect our ability to maintain and participate in good education, which also just starts to open up and give us more access to health care, and also helps us obtain financial stability that again may open up some doors for health resources and access. And the third pathway, and the final one in this paper, is a behavioral pathway. So religious doctrines a lot of them promote the care of the physical body. Even in the Christian tradition, it talks about how we think of our bodies as the temple of the Holy Spirit. So if you think of your body that way, and people take that seriously, then it usually affects our behaviors and our health behaviors. So less cigarette smoking or none at all. We typically will consume less alcohol or refrain from drug use and things like that. So you can see that if you see your body in that kind of way as a holy temple, that usually affects your. So as you can see, these religious and spiritual acts, rituals, participations absolutely has an effect on your kind of mind, body, and spirit, all those different aspects of it. So while most of the quantitative research that's going on is about overall health, this particular study was about cardiovascular health, and it's admitted that there needs to be more particular research in relationship to religion and spirituality and cardiovascular health. But I think these three pathways have given us something to think about, and my hope as I end is that you just don't ever underestimate how powerful it is to be connected to a community and to a community that is drawing you closer to the transcendent, to whatever higher power it is that you find meaningful, to closer to each other, to be in a relationship with each other, because it absolutely makes a difference in your heart health.
Thank you, Reverend.